So how do you find coming to the Dementia Hub?
I find it very relaxing. I enjoy coming. The girls who, the carers, are extremely nice and very caring, and just everything about it. It is just very nice.
Oh, lovely. And what about you, Nancy?
I enjoy coming because I live on my own, and just coming with the bubble of people talking and the interest that you go home with. So that's what I like. And having been a short-hand typist, if I get bored with them talking, I take it in my mind.
You can take some notes.
But I look forward to getting ready and coming.
That's what I find so nice, so caring, and it just is very nice. I really enjoy coming here.
That social aspect is important.
And you can relax and you can talk to people who are the same as you are.
And is it useful to you, the hub? Even the social part of it is nice, isn't it? But would you say it's useful?
I think it is, because you relax.
Yeah.
When you come, you relax and you're not worried about anything.
Yeah.
You're just happy to listen to other people and think, well, aren't I lucky, or oh, did they do that? And you go home and you're thinking about it, aren't you?
I haven't been sort of very long knowing what I've got, but I can tell that it's gradually getting a little bit, sometimes by a little bit, because you suddenly find that you're so, I stand there and I think, I don't know what I'm going to do, I don't know how this is, or I don't, and it just takes you away when you come here, doesn't it? It just, you don't have to worry about that, do you? Because you just keep it together and talking together.
And this is a place where everybody understands that.
That's right.
You don't need to worry if you forget things.
Everybody's in the same position, aren't they?
Yeah.
You can just be yourself, can't you?
Yeah, that's lovely.
And if you haven't got the right colours on, nobody says,
Nobody's worried about it.
No.
So if I asked you for 3 words that come to mind when you think about the hub, have you got any words that come to mind?
Happiness, friendship and relaxation.
Oh, that's lovely.
Well, that's done that one for me anyway, so...
So how have you found supporting patients at the hub? What kind of things are they asking you for support with? What's the main kind of benefits you feel they're getting from Age UK attending the hub?
Yeah, I think coming to the hub is giving them that extra support. They're meeting up with people who are in the same situations as themselves. They're able to relax in a nice social environment. They can also contact the memory nurse who's on hand if they need a one-to-one without making an appointment, so that's really good for them. They can come to me and we can provide lots of information also around social activities as well. So some people feel that if they haven't got somewhere to go, they're losing their support network, so we can provide them with the other alternative social activities. And again, with Age UK, we can provide the carers assessment where we can have a look holistically and create a lovely support plan with the carer in giving that extra support whilst they're providing care to their loved one with dementia. So how are you finding the clinical support from the memory service?
I think from our point of view from the memory service, it's really beneficial for the patients to be able to see a specialist dementia nurse when they come along to the hub. I think for us, even though they enjoy the social element and all the collaborative work in between the teams, I think sometimes they come with very specific questions around their dementia, their diagnosis, symptom management, medication advice, and I think from our point of view, our nurses can really speak to them on a one-to-one basis and have a conversation with the carers or the patients if they've got concerns. I also think that we do a lot of work around crisis prevention, and I think we kind of stop a lot of things getting escalated because the person will attend the hub and we're able to offer that support before things get worse and they end up in a crisis situation. So how do you find coming to the hub? What benefits do you get from attending?
Oh, I love coming. It's a release for me. My husband is just so within himself, you know, and quiet, but he just laughs along, and I can't wait for Wednesday morning. Yeah, now
Really
we've
nice
come
to
to the music group.
Yeah, music in
That was
mind.
yesterday for the first time, and he's looking forward to it, you know, Tuesday next week. So, yeah,
Brilliant.
and I just look forward to coming because I've met friends like Sue, and it's just nice to have somebody else to share your, you know, your problems with.
Do you find the peer support really useful from meeting other people, looking
Yeah.
after people with dementia?
Yeah, I
and
definitely
carers?
do. You feel like you're not on your own, because when you get that diagnosis, you just feel like bogged down, and you just feel on your own literally. You don't know which way to turn. And so coming here, we come to the music group as well. We absolutely love it. It just uplifts you. And I've also started coming to the carers group on a Thursday morning as well. So we love coming. Tony thinks we're going to the hub every time we go out. We're going to the hub, but we're going to the hub. Yeah. So.
What would your message be to other people who are thinking of attending the hub, maybe a bit wary, because I know people get a bit nervous about coming to a group situation?
Well, Tony didn't want to come at first because we met a few friends at the brain gym, and they started to come. So eventually we came, and I just said, do it. Absolutely do it. It's a lifeline for me.
I think from our hospice perspective, one of the really significant goals that we started out with was to improve access to specialist palliative care for people who are living and dying with dementia. We're really just starting to see the fruits of that now. So we're starting to see people who have come to the Dementia Hub start to move through our clinical services, which means that they have easier and earlier access to specialist palliative care, and it also means that there's better wraparound support for carers and families. One of the things that has worked really nicely is our collaborative work with other services. So the Memory Assessment Service have been absolutely integral from the beginning. We also work with Age UK, and more recently we've worked with the Camerata Orchestra on their Music in Mind project. So we've been able to bring some music groups to the hospice, and the wellbeing benefits for carers and for people living with dementia have been very, very significant and very clear to see. We've also been able to develop our services in line with what the service users are expressing that they would like. So we've recently started a carers group, and because we have both the internal links and also the collaborative working with other services, it's really supported us to help people to navigate dementia care in Oldham.